can use it in two ways. You can order it directly from our website, but you can also work together with the clinical practices that use GlycanAge, that offer GlycanAge testing as part of their protocols. So in both ways, you are combined with professionals, experts that know how to interpret the results, because sometimes knowing how to interpret the GlycanAge data can be very complex, and actually drawing what this means for you as an individual takes some time to learn. So in both ways, you actually work with a professional, with the expert that can help you read what your results tell you and what should be the focus area to start your health optimization journey, and to actually work with you to know what is doable at this current moment for you. So we in GlycanAge are focused on measuring and controlling one part of the aging process, and that is the inflammaging. So everything that works in controlling the inflammatory processes is going to work in generally improving GlycanAge. So whether that is adapting to an anti-inflammatory diet, or fixing the exercise regime, or controlling your chronic stress exposure, this is a very big problem these days, because a lot of people have very demanding jobs, and actually the modern day of living is not very healthy for our aging process. So this needs to be monitored and controlled in some way. Also, we have kind of an epidemic of loneliness, which we can actually determine, and we can see the connection between our mental and emotional state and the way that our immune system works. We can detect this in glycans. With exercise, what is interesting is that there seems to be a Goldilocks zone of the beneficial effects of exercise. So, and we see similar pro-inflammatory patterns in people who are very sedentary, but we also see those patterns in people who go to extremes. So, for example, professional athletes who have a training routine once or twice or maybe more per day. So it's also very important to know what your personal Goldilocks zone of the beneficial effect of exercise is. There's lots of success stories, and this is one of the most exciting parts of what I do, talking to these individuals that, for example, maybe they struggle to find answers. They felt like something is not right. They do not feel right, and they, for example, suffer through fatigue syndromes, or they just do not feel like their old selves, and they try to go and seek answers in this classical medical route, but it perhaps is too early for them, and there is no medication, or they have some different diseases, or it's just the beginning of the development of the disease, and they find the indications in the glycans that the inflammatory process doesn't work in proposed ways. And together with our specialists and experts, they actually managed to find actionable steps that allow them to feel like their old selves again. And one of the most common examples that we have are women that are entering the perimenopausal period. So that's a period where we experience certain hormonal disruptions, but the cycle is still there yet. So menstrual bleeding is still present. So it's not the full onset menopause, but it's some period in between. And in some women, this perimenopause period can last 5 years, 6 years, or even longer. So it's a very challenging period, and it's very difficult for them to actually know, are they entering it, or is this because of various stressors that occur in this time of life. So with GlycanAge, they have managed to see some cues that something is actually happening, something is getting worse. And together with the experts, they have managed to find appropriate therapies and lifestyle adjustments that make them feel better. So it's very exciting to hear out these cases. Depending on what you do, how does your protocol look like, the recurrence of the test should be adjusted. So for example, if somebody is trying out a new medication or a new hormone replacement therapy, we would already see changes about 3 months after the implementation of such changes in medication and therapies. If somebody is taking a more moderate approach and perhaps changing a dietary pattern or an exercise regime, it should take about 6 months for us to see notable changes in their glycans. So it depends on what you are doing. If you just want to monitor and kind of register your immune system health, then a yearly checkup would suffice. It's one of the tools that allows people to actually think about the aging process and think about mortality. And this can be a frightening thing, but it also can be a way to talk to your future self and to see how your future self needs to behave and how you want your future self to behave, and ask yourself, okay, what do I need to do now in order to achieve happiness and well-being for my future self? We deal with a lot of biohackers, a lot of people that are trying out different longevity and biohacking protocols, and they oftentimes use GlycanAge as a way to evaluate those protocols. So one of the most common mistakes that we see in that department in biohackers is over-exercise. So like I said before, there seems to be the Goldilocks zone of exercise effect. So too much of it can be pro-inflammatory, and especially if it's combined with a lack of recovery. So not allowing the body to sleep enough and to kind of work through all of this muscle damage and all of these things that occur during exercise. And the second most common mistake is, I would say, falling into marketing of longevity molecules. So a lot of people take 20 plus supplements in order to optimize their longevity mechanisms, and the science behind it, it seems solid when you first hear it, but a lot of these molecules and supplements work on a mechanism called hormesis. So they activate small amounts of stress in our immune system in order to make the immune system more resilient. However, if you combine them, this is not a small amount of stressors, it's a huge amount of stressors. And if this is combined with poor dietary regime or lack of sleep, it actually shifts the immune system towards being more pro-inflammatory and more prone to disease development. So I would say sticking to the basics, which may be boring, but they actually have a beneficial effect, and leaving the supplements to perhaps a later time where we have when we have more evidence of the exact mechanisms and the exact combinations that work for you as an individual.
Mm-hmm.